Okay, so knee special tests. We're going to start with the pivot shift. So the pivot shift is used for any ACL ruptures. So what I'm going to do is start with the leg fully extended, or the knee fully extended and the hip flexed to 30 degrees. I'm going to internally rotate the tibia and put a valgus force on the knee as I slowly move the knee into flexion. A positive test, as I start to move the knee into flexion, there'll actually be a posterior subluxation of the tibia on the femur. So I push in, and so she has a negative test, but positive right about there. The tibia will sublux posteriorly, and you'll feel both the therapist and the patient will feel a clunk. McMurray's is a test for meniscal tear. So with my index finger and my thumb on the eyes of the joint, I'm going to bring her into full flexion into all the quadrants, also applying valgus and varus forces at each one and moving her through the motion. Positive sign for this test would be any clicking or clunking in the joint. Okay. Anterior drawer test, another one for ACL. I'm going to have her flex her knee. I'm going to stabilize her foot by sitting on it. Thumbs in the eye of the joint, hands around the back, grasping the tibia, and I'm just going to pull the tibia forward out from underneath the femur. Positive test is any laxity, any gapping, or any pain. Obviously the laxity and the gapping you have to test against the other leg to see if it's any different bilaterally. Then I'm going to have you hold this for the next couple tests. So a Lockman's test with the knee slightly flexed is another ACL test. I'm going to stabilize the femur with one hand and then grasp the tibia with the other hand. And the idea is to stress the ACL by pulling the tibia forward. A nice strong snapping end feel is a negative test. Positive test would be pain or any laxity or the absence of an end feel at all. And then the valgus test is for MCL. It's done both in full flexion, or in full extension and slightly flexed. What I'm going to do is hold the tibia with one hand. Using my other hand, I'm going to grasp the outside of the knee, start fully extended, and I'm going to add a valgus stress. Okay, and then slightly flexed. Do the same thing. So a positive test for that would be pain along the medial side of the joint or any laxity